Joining me now in a Fox Business exclusive, ŌURA CEO Tom Hale. Well, what kind of data did you discover from the FRAM?
Well, you know, the data hasn't actually been analyzed, but they did collect from 4 humans the impact of spaceflight on the body. And they actually had a number of firsts. It was the first polar mission that went north to south as opposed to around the globe this way. And also, they had the first X-ray in space of a human hand. And of course, what was on the human hand? An ŌURA ring.
No.
Yeah.
Oh my gosh, that you must have been
over the moon.
Orbit. Yeah, over the moon, exactly. Well, tell me the application for this eventually, and are you talking to an Elon Musk about testing or revealing some of these biometrics and discoveries that you've made for when he eventually gets people up in?
It's clear that you need to understand the impacts of spaceflight on the human body, particularly if you're going to take a longer voyage. One of the things that the ŌURA ring is particularly good at is it sort of gets to know you. So it understands your particular baseline and what normal looks like for you, so that any deviation from normal becomes very clear, and so that the software that's interacting with the ring will be able to say, wow, something's going wrong, we should pay attention to this, or you're doing fine. Because not everybody is the same, and I don't think everyone's going to react the same way when they're in space.
Well, just when Apple got everybody wearing the Apple Watch, in comes the ŌURA ring, and I have both, but I will tell you this is a lot easier for me because you sleep with this on. It's very uncomfortable for me to sleep with a watch on. And also, I keep looking at the watch in the middle of the
night. Right, it's lighting up and you're getting notifications. That's actually something that's really intentional about our design, which is that it doesn't have a screen. It doesn't vibrate. It doesn't, ask for your attention. It has a super long battery life, so you're not constantly having to charge
correct?
it, right?
The new one?
Up to 8 days with the largest size ring, because the batteries are the different sizes for different rings. But really long battery life. And the impact of that is that you just don't have to think about it. It's just not another thing that's asking for you to feed it, another digital mouth to feed. And what's great about that is that when you're sleeping, your body is in the same state night over night. And so the signal that you can get about your body is very clean and very clear, and then the software can really give you insights that are meaningful.
What I've noticed is it's very much a report card for your sleep,
Yes,
meaning you
right.
find out exactly what your grade is for deep sleep, REM sleep, rapid eye movement sleep, I guess readiness. Did you have enough?
Did you get enough sleep? Did you get enough quality sleep?
Deep sleep is terrible. It's 39 minutes or something.
Oh, we got to work on that.
Okay, so does it tell you? Because I'm looking around, it says, oh, try harder, make sure you maybe don't take a nap or whatever.
Well, the classic things, and by the way, this is, born out from science because we're very much founded in science. The classic things to do is avoid eating late, meaning if you have enough time to digest your meal before you go to sleep, your body will be primed to go into deep sleep. Avoid alcohol, which frankly, alcohol is very, very bad for your health in general, but it's terrible for your sleep, especially your REM sleep. And then to prime your body for sleep, one of the things people don't know is that when you go to sleep, your body temperature actually drops. So sleeping in a cold room or taking a hot shower, which forces your body to cool itself, is a great way to prime for a good night's sleep.
I'm all about being very cold at night.
Yes.
I want to be Mr. Freeze.
My wife as well, yeah.
So when you talk about scaling up, this is great because you're now working with medical institutes and looking at possibilities in space, but that's a long way away.
Yeah.
These year-long trips to try and get to Mars. Closer in, the military. In October, you had a deal with the military. The Pentagon gave you a $96 million contract to get 200,000 ŌURA rings on military men and women, which to me is brilliant because these guys need their sleep, do they not? But then it was pulled in April. What happened there? Was that a DOGE thing?
Well, so we have been doing business with the Department of Defense since 2019. And there's a whole range of use cases, whether it's, trying to help people understand if they're getting sick on board a ship or help them understand the impacts of fatigue.
But did DOGE pull that?
So what happened is we actually had a 5-year contract. And it wasn't actually for servicemen and women. It was for the doctors and nurses who care for the servicemen and women. And in the process of reviewing what is a pretty significant investment, they decided to pull the contract. But the thing is that since the first of this year, we have had 100 contracts signed with the DoD. So this is just one of many contracts for us. Turns out, and this is a surprise for many people, the Department of Defense is our largest customer. And that's because of these really powerful use cases to both protect people's health, but also to optimize for readiness, which is something you want from your military forces.
Wow. Okay. So can I ask, are they on Navy SEALs' fingers?
They are on Navy SEALs' fingers, but I can't tell you who, obviously.
Okay.
Yeah. There's one of the most interesting use cases. It started with people trying to figure out how to manage fatigue when they're, piloting these incredibly expensive kind of giant machines. They want people to be like at their peak, at their optimal, even if you're pushing them the hardest. So one of the things that we do now is that sailors are wearing this ring, and their data is beamed to an onboard secure server, and then the system on that server understands who should be deployed when and where and who needs to rest. It's basically how they schedule the shifts on board the ship. It's a really fascinating use case, all automated, completely secure, completely private. It doesn't go to your phone, for example. It's happening on board the ship. This use case, which is called CREW, is in use by the U.S. Navy, and it's been deployed in many places around the globe.
Does it take into account that some people operate best with little sleep?
You know, it's interesting. This is the whole thing. People are not cookie cutters. People have different, ways of responding to different stimuli, different inputs. Some people can manage on 2 and 3 hours of sleep. And by the way, I'm guessing that's probably the case in the military. There's going to be times when you're going to be pushed to your absolute limit. The key is that your command needs to understand how far can you push?
I see.
And when does it become a risk? If you're flying a plane with 50 people on board,
Pilots.
you got to be on your game. And by the way, they're flying for 30, 40 hours at a time.
Tom, a torrent of competitors have swarmed around you. Everyone from the Galaxy Ring to Whoop, which was the one that complained to the DoD, saying, well, the procurement process wasn't fair. You gave it to ŌURA. Samsung, of course, the Galaxy Ultrahuman. Ultrahuman says trade in your ŌURA ring and we'll give you money for the new ring. So how do you stave off these competitors?
Competition in business is just a fact of life. And honestly, if we didn't have any competitors, I would be worried because it means we wouldn't be doing something that was important. The reality is that we are really far ahead of most of our competition, and we have the canonical intellectual property, which is so important to protect innovations like the ŌURA ring.
Tom Hale, ŌURA Ring CEO. Wow, very interesting. And I've been checking my sleep, and then I get nervous, and then I feel like, oh my God, I didn't get enough. Got to work it. So important. How many hours of sleep do you get a night?
Well, this last night I got 5.5 hours, which is decidedly not enough. I'm not a short sleeper, but generally I'm about a 7-hour sleeper.
Okay, isn't that what you recommend?
8 hours would be better, but I'll go with 7.
Tom Hale, it's great to see you. Thank
Thanks,
you.
Liz.